Hello and welcome. Today will be part 3 of our doctor's palm readers. Well, if you've watched part 1 and 2, you already know that doctors are not palm readers, but then doctors are trained to be able to, by observing, make certain diagnoses. Today we'll be looking at the part 3, which will be dealing with the MCP joints. Remember that this joint is called the DIP, or the distal interphalangeal joint. This joint is called the proximal interphalangeal joint, or the PIP, and this joint is called the MCP, or metacarpophalangeal joint. So what are the conditions that can present with pain of this joint? Number one, osteoarthritis. I'm sure by now, if you've watched the part 1 and 2, you will observe that osteoarthritis can affect this joint, and this joint. When it does affect this joint with bony lumps, we call that Heberden's nodes. If it affects this joint with bony lumps, we call that Boucher's nodes, and then it could also affect this joint. Number 2, rheumatoid arthritis. Number 3, lupus. And then number 4, hemochromatosis. Well, I think that's the term you most likely haven't heard in this series. So for osteoarthritis, rheumatoid arthritis, lupus, I've already explained these in previous videos, or particularly the part 2. So today I'll focus a little bit on hemochromatosis. So what essentially is that? It's a condition where the body absorbs and stores excess amount of iron. The body absorbs and stores excess amount of iron. Over time, if this is not dealt with or treated, it could result in damage to joints. Particularly, hemochromatosis affecting these joints, called the MCP joints, can present with what is referred to as hook-like osteophytes. So when you see a radiograph or an x-ray, you will see those bony spores, particularly in the second and third MCP joints. They're called hook-like osteophytes. So for part 1, part 2, part 3, we've looked at involvement of the DIPs, PIPs, MCPs, and then in the part 4, that will be coming up. Thank you.